For your obese patients, there is most likely a pannus or large belly covering the genitals. Because of this, using a wrap in the traditional method isn't possible. In this application, we'll be using 2 wraps. And although it's not required, but it would be helpful if there were 2 caregivers involved. First, cover up the Velcro hooks so that it doesn't abrade the patient's skin. You're just turning the Velcro hooks into the absorbent side of the wrap. Cover the Velcro on both wraps. Then your helper is going to come in and move the belly away from the area around the genitals so that the genital area is exposed. The first wrap is going to be brought as far underneath the scrotum as possible. Then tuck the QuickChange gently in between the legs. This is going to catch any runoff and it will help with skin integrity on the patient's legs. Then take the second wrap and create a circle. Now, while the belly is up and away from the genitals, you're going to fold the second wrap over the source of the urine so the absorbent part is centered right up against the source of the urine. And then imagine my hands are the pannus coming back down over the top and resting on top of the QuickChange, holding it down in place. This approach also will keep any moisture or urine from going up and under the pannus and causing any further moisture or fungal type of irritation. The approach with 2 wraps is also very useful for patients where the penis is buried under subcutaneous fat and nothing is really available at all. If you have any additional questions on the QuickChange wrap and how it can be more effective for your usage, you can find us at our website, QuickChange.com, where we have several videos on the wraps as well as various materials and instruction guides for downloading. We also offer virtual in-servicing live from our broadcast studio over platforms such as Zoom and Skype, where you and your team can interact with our clinical educators. Feel free to call us anytime at 1-800-206-2816, where we can walk you through any situation.